week, the second wave of the pandemic showed the frailty of our healthcare ecosystem, especially in rural India, where we don't have enough radiologists, let alone COVID tests or CT scan facilities. To solve this crisis, ArtPark, a not-for-profit foundation set up by Indian Institute of Science, Bengaluru, with support of AI Foundry, in collaboration with Niramai and Indian Institute of Science, has come up with an AI-driven WhatsApp chatbot solution, XraySetu. Officially launched in May end this year by the Ministry of Science and Technology, XraySetu is free of cost and can be used by doctors across India, and it claims it can help detect COVID at an early stage through a simple X-ray. To find out how, let's talk to Umakant Soni, founder and CEO of ArtPark. Umakant, welcome to the show. Let me start off with this fact. There is only one radiologist for every 1 lakh people in rural India. Given the pressure our healthcare systems witnessed during the second wave of the pandemic, tell us how, the WhatsApp-driven XraySetu can help ease this burden.
Thank you. Thank you for having me on the show. I think one of the biggest challenges that we have in India is that the healthcare infrastructure is very uneven and quite sparse in rural areas, right? 65% of the 1.36 billion population lives in rural areas, right? Which is poorly serviced in terms of healthcare professionals as well as facilities. So just to give you a perspective, so we have like 10,000 plus radiologists working in India, which is quite low itself. But then out of that, maybe only 1,000 plus are available in the smaller towns and rural areas, right? We have 3,000 CT scans, but mostly they're there in urban centers. If you compare it with that, we have 80,000 X-ray machines operating all across India, and they have a pretty good density in even smaller towns and smaller areas. And so when the wave one hit, we realized that, while everybody's trying to get RT-PCR tests done, what is important is that people are able to actually assess the state of the lung. And if the lungs are healthy, then the person doesn't need severe hospitalization, and then the system is able to take care of it. So that is the reason why we started to build this XraySetu with help of AI researchers at ArtPark, Niramai Health, and IISc. And we built it over the last 10 months.
Yes.
And we piloted with 300 plus doctors.
Okay. All right. Tell me now that, XraySetu uses AI algorithms to detect low-resolution chest scans of suspected patients. It also uses WhatsApp as a key facilitator in the process. Explain for our viewers how the process works and a step-by-step guide as to how can one use XraySetu.
Absolutely. So all of this is actually live at www.XraySetu.com, so you can go to the website and read more in detail. But very quickly, the way it works is that the rural doctor is seeing a patient, and he has got an X-ray. He can just put it up on the white light viewer, which they normally do. They can take a picture of it, and we have a WhatsApp number on which they can send this picture. On our end, we do this image review, and we send it to the XraySetu AI service, which looks at it across, the length and breadth of it. And within minutes, we are able to generate a report, which we share it with the doctor. And based on that, then he can advise the patient further on. Three major things that we have actually innovated on. One is that, of course, it's operable over WhatsApp, a tool that everybody in India knows how to use, especially the rural doctors. And so it's very quick and easy for them to use. Second is that it works on even low resolution images, because when you send X-ray images through WhatsApp, it compresses it. So it is specifically designed to work with high amount of accuracy over the WhatsApp images as well.
All right. Umakant, XraySetu is the brainchild of ArtPark, the Artificial Intelligence and Robotics Technology Park, which is promoted by the IISc. The health tech startup Niramai has also had a key role to play in bringing the product to the masses. Can you tell us how XraySetu was incubated, tested, and validated before the launch?
Absolutely. So when the wave one hit, we quickly got people around, especially Dr. Chiranjeev Bhattacharya from Indian Institute of Science, Dr. Geeta Manjunath, the co-founder of Niramai, and we basically came up with a solution that was available very quickly to use on WhatsApp groups, which was being used by 300 plus doctors, thanks to Dr. Sadanand Kamath in rural Karnataka. And we worked with this 300 plus doctors group, and we got validation from them over 10 months. And with the deep research over 10 months, we finally were able to launch it as part of chatbot. And then we took it out, all across India. And so far, we are seeing very healthy usage 3,500 plus doctors and X-ray technicians have used it.
Yeah. Okay. Umakant, like you just mentioned, at present, XraySetu is helping over 3,500 doctors and X-ray technicians across India. You say that the primary focus is to assist rural healthcare in India with XraySetu. There is a plan to target rural doctors and diagnostic centers. Can you tell us how many doctors or diagnostic centers are currently using XraySetu, and how do you plan on expanding the base in the coming months? How many scans have you done, and what are the priority states on your list?
Absolutely. So there were very heartening stories that are coming out. I mean, we had one Dr. Narayan from small town in Odisha, and he sent us this wonderful text that he has been using this service, and he has used more than 26 X-rays. He has tested our service out, and what he found was very interesting, that they were correlating very well with the RT-PCR test. And this was such a pleasant surprise to us, because while we had tested it on the lab, and we had tested it on the small group of doctors, we were not sure how it will actually pan out when we released it all over India. And not only the doctors, but we found very interesting. We found it. One of the radiologists who was actually in rural Uttar Pradesh using it, and he sent almost 40 plus images. And he has been using it. He's validating it, and is finding a great correlation. So we are seeing all the states across India, they're finding it good usage. And in fact, some of the network actually went outside India as well, and they tested out the service and they found good correlation. So it's kind of very interesting to see, so much of usage coming from all parts of not only India, but actually globally world as well.
Okay, so can you give us a number? How many scans in total would you have done on XraySetu till date?
Sure. So far, I think we have delivered 3,500 plus X-ray reports on XraySetu, and every day the number is growing. And I think we are fully prepared for wave 3. We can do up to like 1,000 X-rays per hour. I mean, God forbid if wave 3 hits.
Okay, so you can manage up to 1,000 X-rays per hour. Umakant, given the fact that XraySetu is a digital service that requires internet connection and a decent smartphone, what are some of the key challenges you've faced in trying to take this product to rural India?
Absolutely. I think the reach of WhatsApp is quite deep in India, and the users also know how to use WhatsApp. They are already used to sending the X-ray images, and what we had to teach them was how do you send X-ray images? How do you take really good quality X-ray images for us to be able to give you the right amount of accuracy in the report that we are giving that back to you. Another challenge that we found which was interesting, was that we have to actually use the vernacular languages in form of articles and videos. And how do you actually translate the terms that we were using in terms of artificial intelligence, so that the average person on the ground can understand? And it also highlighted, to us that, what challenge that we face in, communicating the accessibility of the service in the rural areas.
Okay. Umakant, take me through the other use cases of XraySetu apart from COVID. What are the other ailments, it takes care of?
Absolutely. So we can detect the state of lung fairly accurately, and we can detect around, apart from COVID, 14 other lung abnormalities. Apart from COVID, we are looking at actually focusing on TB management, because that's a major use case. And we're also finding good correlation in the lab when we are testing it. So these are the things that we are actually looking to go forward in terms of post-COVID. But we still see that the biggest use case for the months to come is going to be just managing the XraySetu the patients which are suffering from COVID, because even though you might be RT-PCR negative, you might have recovered from the COVID, but you still the health of the lungs may not be up to the mark, because you could still have fibrosis in your lung. And it is important for the patients to do post RT-PCR negative check of their health, the state of the lung, to actually ascertain whether they're ready to go back to the normal life. Because if they're not ready and they go, they could actually lose their lives. And we are seeing quite unfortunately happening with quite a few patients.